been about 6 months since my chemotherapy was over with. Can't believe that it's been that long, but it has. And today I just thought I'd tell you just a little bit about radiation therapy for your cancer. In my case, they didn't think I was going to need chemotherapy, so they sent me to radiation therapy first. I've been told that it's normally the other way around. They send you to chemo and then to radiation, but not in my case. And when they told me about radiation, I had a couple of choices. I could go once a week for about 10 weeks. The second option was to come twice a day for 5 days, which to me made more sense. Yes, it's going to break up my day, especially when I was still working. It has to be at the same time each day. So my time was around 10 in the morning and 4 in the afternoon. To me, getting it over with in a week's time, with a weekend in between those times, was a better option for me. I just wanted to get it over with. I didn't want to have to continue to do this every 10 weeks. And what they do pre-appointment is to look at all the information and make tattoos. It's just like a tattoo. It's a little dot that they put in certain areas where they want to put the radiation, get the beams to go in the right spot. That hurt just a little bit, but not that much, just for a second. And they also give you, in my case, a card to scan to get into the radiology department, because instead of going through the front of the oncology department and going through the reception and saying, going to sit at the reception area and wait, since you have to have your radiation at a particular time, I went in on the side of the building that went directly into the radiation department. And of course, they keep that locked, so I would have to buzz to come in. And then I would walk right up to the desk and use my scanning card to scan. Just tells all the information about me, at the time I arrived and what kind of radiation and such that I needed. So that was kind of the way to check in. And then you would go directly to a waiting room. There was a his and a hers waiting room, and where there's a line of chairs for you to wait if someone's using the 2 dressing rooms that they had. If not, you would go directly into the dressing room. It's just a small room, and the shelf had a number of gowns on it for you to take. And so whatever part of the body they're doing, you need to, like for me, since it was breast cancer, I would take off everything on the top and put on a gown. And then I would go back out into the waiting room and wait for them to call my name, which was usually a very short amount of time, and then go into the room where they actually do the radiation. Now, it's called, I think another word for it is proton therapy. It's a highly effective form of cancer treatment. They put high doses of radiation where your tumor is, and it's to destroy the cancer cells and to shrink tumors that you may have. The machine never touches you, and it's a LINAC, is linear accelerator, is another name for the machine that they use, and it's quite large and I'm sure quite expensive. It takes anywhere from 10 to 30 minutes for them to do the radiation. Machine never touches you. I never felt any pain whatsoever. It was very loud, but I just had to lay there. They of course put you exactly how they want you on the machine before they put you, move you closer to the machine. And some people have had some reactions to it, nausea, vomiting, diarrhea, that sort of thing. But I never really felt much of any reaction. I was very lucky. To me, it was kind of tiring because you have to go twice a day and make sure you get there at the right time. But I didn't have any other symptoms of the radiation. Um, so after they're done, and I think mine lasted about 15 minutes. When it's done, you just get up and you go back into the HERS waiting room and go into one of the rooms and take your gown off and throw it in a basket, and then you were free to leave and to repeat it later that day. And so for me, it wasn't an unpleasant experience. It just I did have to get permission, and they were very good about letting me leave work twice a day if I happened to be working that day to have my therapy. But it didn't take very long, and I was usually back within 45 minutes to an hour after I left, so I didn't miss out on a lot of work. It can be a little scary when you walk in and you see this huge machine, and but it was a good experience for me. But if you do have to have the proton therapy or the radiation, it's nothing to be afraid of. And most people, I think, don't have very many reactions to it. So I hope that helps to clear that up, and your radiation will probably be very similar to what I had. So it's really nothing to be frightened of. I think the only downside of radiation is that it takes a while for your body to react to that radiation, but it slowly does. Because I had breast cancer and it was in my breast, it has slowly darkened the color of my skin, and my breast tends to, I don't understand why, but it tends to draw lower. So my oncologist said to make sure that I continued to, and actually no, it was my breast surgeon was the one who told me to make sure that you keep it moisturized. I used Aquaphor. It's a very good moisturizer to try to help that. But I think there's some of it there's not much you can do about it. Your body slowly reacts to it, and it takes time, and your area will get darker where they had the radiation. But for me, it was a small price to pay for it to work on killing my cancer cells. So I hope this helps a little bit, and if you have to have radiation, you won't be so frightened about the experience. See you next time. Bye.